Excellent. Okay. Honorable Minister of Health, Director of Health Services, Acting WHO Representative, MSF Head of Mission, members of the Ministry of Health, civil society, implementing partners, people living with HIV, distinguished guests, good morning all. It's a pleasure to be with you today for the launch of the HIV self-testing campaign. The cornerstone to epidemic control is case finding. Case finding can identify those who are unaware of their HIV positive status, those who are most at risk of HIV infection, and those in need of treatment or prevention services. In 2012, the first ever rapid HIV home test was approved by the U.S. Food and Drug Administration. These tests granted individuals the ability to test themselves for HIV in the privacy of their own homes, without a special trip to a healthcare facility, and obtain their results in minutes. Since their approval, these tests have been associated with many benefits, including increased access to testing, earlier diagnosis for those who do not have routine contact with health services, autonomy and privacy for test users, increased HIV status awareness, and higher HIV testing rates. HIV self-test kits were introduced in Eswatini in 2017. At the time, the country's UNAIDS 95 accomplishments sat at 80, 87, 92, with large lags in testing rates among males and adolescents. Distribution of the test kits resulted in hundreds of people requesting information on prevention services, reporting HIV self-test results, and getting diagnosed and linked to treatment. With the initial introduction of HIV self-test kits, the Ministry of Health received insight around the acceptability of the kits, but also offered men another opportunity to test, since men are often reluctant to access health facilities. Another key finding from the initial years of HIV self-test distribution in Eswatini was the rate of acceptability and enthusiasm around secondary distribution. Secondary distribution of HIV self-tests allowed health workers to distribute additional test kits to at-risk individuals so that they could, in turn, distribute them to their partners, children, or at-risk associates. These findings showed that targeted case-finding efforts were feasible and acceptable in Eswatini. Building on these lessons of HIV self-testing implementation, the Ministry of Health, with support from PEPFAR and other stakeholders, has created a strong and efficient program for the delivery and follow-up of HIV self-tests. This programming, in part, has led to Eswatini's incredible accomplishment of achieving the global 95-95-95 goal. This year, PEPFAR supported the Eswatini Ministry of Health with over 260,000 HIV kits for distribution through clinical, community, and faith-based settings through the new Faith and Community Initiative. This initiative heralded a new, unique partnership between the Ministry of Health, the Eswatini National Church Forum, and PEPFAR, designed to strengthen the demand and delivery of HIV testing services through multiple programmatic elements, the capacity building of hundreds of faith leaders and community carers across denominations and across the country in order to provide HIV services to their communities. These multi-day trainings focus on ensuring all participants have a deep understanding of HIV, including transmission, prevention, and treatment. Sessions have included content on faith healing, prevention of sexual violence against children, and stigma reduction. The second element of the program centers on dissemination of positive messaging around knowledge of HIV status, newly available treatment options, stigma reduction, and HIV prevention methods through voices at both the community and national level. The third element focuses on direct service provision to faith community members through faith leaders and community carers. This is done through health information sessions at the church level, HIV self-test distribution and assistance, and linkage to prevention and/or confirmatory testing services for HIV self-testers. Through the Faith and Community Initiative alone, thousands of HIV self-tests have been distributed to at-risk individuals, men, women, and adolescents who otherwise might not have sought testing services. And these people are in both rural and urban communities. The success of the distribution program is attributed to the wide array of distribution options available to each community. These options include distribution at church, shops, pharmacies, community pickup points, personal delivery, and anonymous distribution methods. This distribution and subsequent follow-up by healthcare workers has resulted in the identification of over 300 individuals eligible and referred for community testing, and over 15,000 individuals referred for prevention services such as condoms, VMFC, and PrEP. When faced with challenges due to COVID-19, the Faith and Community Initiative systems were leveraged to quickly and efficiently deliver COVID prevention information to the community level, community carers, leaders, and faith-based organizations. The faith communities were supported with up-to-date information in conjunction with resources on how to create simple hand-washing stations, how to make masks from household items, and how to identify and respond to gender-based violence during lockdown. FCI delivery mechanisms were also able to continue delivering HIV prevention and testing services during the national lockdown, where people were unable to access health services due to travel restrictions and COVID fears. PEPFAR will continue its commitment to realize epidemic control in Eswatini and maintain the country's gains despite the COVID-19 challenges. In 2021, PEPFAR will continue to provide technical support and refine the HIV strategy to improve case finding. With the accomplishment of the 95-95-95 target, it will become more difficult to identify and diagnose those who need HIV testing services. This effort will require directed strategies that include recency testing, targeted HIV testing, and continual surveillance. PEPFAR will continue to work with the mission to improve access to HIV self-test kits for those voters. Targeting the most at-risk individuals will be accomplished in healthcare facilities through deliberate distribution of kits in antenatal care clinics and through index testing counselors. In communities, kits will continue to be distributed through the FCI delivery systems and community testing services offered through programs catering to vulnerable populations such as adolescent girls, young women, and key populations. Peer navigators will optimize distribution to key populations using social network approaches to improve case finding. Healthcare workers, expert clients, and community carers will continue to reach out to its in-person messages and phone calls to encourage linkage to HIV testing or prevention services, dependent on the test outcome. As we close the gaps on 95-95-95 for all age groups and demographics, PEPFAR looks forward to continuing to support the government of the Kingdom of Eswatini and the Ministry of Health to achieve ongoing success, one HIV self-test and one client at a time. Siya Bonga.